I hope you've all had a good boost in the sugar levels. I thought the brownies were particularly good. And are ready to face the second half of the morning. Fabrice is now going to touch on a subject that is quite dear to my heart, and that is learning from other disciplines and the cross-disciplinary approach to the horse world. And I think disciplines here, you don't mean veterinary disciplines, you're talking about
horse discipline.
Equestrian disciplines, including racing. So, Fabrice, over to you.
Thank you. So for this topic, I just try to think a little bit of what learned me the other discipline to try to understand better some disease of the thoroughbred, and what probably to show you also the trainer together can learn from each other also. So the reason why, Grosbois was created in the 1985, and it was just a center that was just like a Spanish room, or I don't know what you say, a place where we just here to give a service. So when I start in 94, so you see, 30 years ago, just to clean the clinic, and then my role was just to make X-ray, and to make anesthesia, and to take care of the horse on the hospital. That was not operated by me, but by many vets. I think when I started, there was 20 vets coming every day. Just, hey, Fabrice, can you do the X-ray for me? Can you do the scope? Can you make the anesthesia? And can you take care of that? So it was the history of Grosbois. We were just service and no clients. So it changed a little bit. We have some clients now, but 95% of my activity is referees. And in this clinic, you have thoroughbred, sport horses. So it was not only standardbreds. And that's the first part. So the service, mixing all the population of horses, but all the population of vets. So I think I should have 250 regular referral vets that lead to the case. And the other thing, I started in Grosbois. I was 24 in Grosbois. And when I start, so all the trainers that are the top trainer today in France, here in this place, there's 1,600 trotter, the top on Europe. And all the trainers were the same age of me when they started, so they are all good friends, meaning that it's safe. They are all friends. To be honest, we go to holiday together. They are godfather, godmother, my kids. We meet every day. We have a problem, I call them. The kids sometimes with my wife, she's also a surgeon. We put the kids on a trainer when there's no school, and they take care of the kids. And so this is life. So it's very important, because the trainer, when they call me for a surgery, any trainer, don't explain me. Do if it's your horses. Or try. I give you one, just try it, this one. Try you. So there's a big trust, meaning that you can make mistakes. You can explain the mistakes, and they tell you when there's a mistake. That's good, without big consequence. I remember when I started to do orthopedy, they called me, hey, Fabrice, the horse you fixed last morning, it's a disaster. So I take it when you have time, but try to fix that. And that's a good thing. So I've learned a lot of this close relationship with the trainer when they tell you the truth, and you have not to invent things. You say, I was not good today, sorry. And that's not a problem, because they are used to fail. A trotter can go to the south of France or to Sweden. All the family, everybody spend 1,000 €, arrive after 5 strides, start to gallop, go home, disqualified, and it's life. So it's and they're really easy guy. They check the horse every day, they palpate, they scope by themselves, they chew by themselves, they make the catheter injection fluid, they do everything. That's good. But I remember when I said, you have no time, can you show me how to tube my horse? If you want, but don't tell it to my boss. So it was this life. So it changed a bit now, there's more regulation, but there's a big trust. So it's learned me a lot. I'll show you a little bit Grosbois, and Grosbois is like a little city. So we are inside. So there's 25 trainers, and everything in the middle of this park, that is the park of the the general of Napoleon I. It was just a hunting castle, and it was bought by the Jockey Club Trotting Association. But there's all these horses everywhere. So it's very nice because, you have always some race to celebrate. So you go in the morning, if you want to fix horse, you go, they bring you the horse. So it's a very easy way to deal with, and it's all my life, meaning that I'm not considered by them like a vet, but more than a friend, a colleague. So for this talk, I think that the main part of that improvement is that I can try things. I can ask, and I can follow my horse. Meaning that if this trotter, they race for 10 years. So imagine you can make a fracture repair or something and get the horse for 10 years and follow him, and for the throat it's the same. So I will try to show you what this trotter and some show jumper has helped me. So the trotter is special. This is is the stable of my best friend. It's in the stud farm. There are also a stud farm. So it was the stud farm in the country when I go for summer. So it's all the training head, the bit and everything. You see, they are everything. And they have an explanation. And it's not always true for sure, but they are an explanation of everything. Any bit, he asks you why he put that, he show you. So it's fascinating what you can learn just by spending 2 or 3 days with these people. They are really experts in things, because trotting is an artificial gait you need to maintain. The very good horse that just trot, but I have 3 or 4 trotters. I used to buy older trotter, but they are so bloody expensive. Now if you want a good one, you need to buy a yearling. So I bought last year 4 yearling trotter and 1 thoroughbred jumper. And 3 months ago, I say, Jean-Michel, there's a problem because all my trotters are galloping and my thoroughbred is trotting. Maybe we have made a mistake. And every race, now they are 2-year-old or just 3-year-old now, there was disqualified. And he told me, no, I need to put this one a little bit in, put a little bit weight on the shoes, then change a little bit detail, change a bit, and then he won 3 or 4 days ago 1-1. But they just changed artificial things. So I realized how complex it is. So they fail, change thing, details. So I learned a lot from that, because it has also an impact of per way. For example, DDSP, the trotter, we fix them sometimes. But don't touch my horse. Let me do, and if I don't manage, you will do it. Then they start change the noseband, change thing, and then, wow, what about your horse? I just won. And you say, it's not possible, because he was, displacing like hell. And then, so I learned things. I learned system of bit with what they call the lasso, some palette to prevent flexion for fungal collapse, things like this, overcheck. So many things you can learn. I don't say that you use like this in a thoroughbred. It's not possible, but you can use the consequence of this strategy in thoroughbred, in show jumping. Shoe is incredible. The shoeing of a trotter. So what is fascinating, they put only shoe for training, and they remove the shoe for racing. So a good trotter in the Prix-d'Amique, no horse has a shoe. It's impossible. And removing shoes, you save 200 meters at the final, at the finish. So when I start in Grosbois, I have a good friend who make a huge amount of money by gambling on the horse that they remove the shoe. Because at this time it was not you can not say in advance to the betting, to the journal. So they remove the shoe, and all the horse remove shoeing was always winning. So it's an incredible strategy, because the horse goes much faster without a shoe. But they have many shoes to change the gait, to adapt the gait, to prevent suspensory problem, to change they need to have the hind leg a little bit outside of the foreleg or inside, so they change everything. The trimming is a big art. So if you want the best fire for a show jumper, you take a fire for a trotter. You just explain it quickly, and you do the best job with a minimal of money and the minimal of metal. They do a good job. The show jumper fire, he arrives for 500 euros after you have a shoe that the horse even cannot move. You don't understand anything, he explains you, I don't understand. The guy arrived, so I have a good fire, he's like this, like a cowboy. So usually you have this very fancy, show jumper rider with a BMW like this, with a pony like this. And I said, I come because you told me you have the best fire. Yeah, I know. And the guy, oh, hello guy, you arrive like this. So the other is, what the hell? And they are really good. So it's a big heart. And I remember the trotters are racing without shoe for 20 years or 15 years. And last year in the Olympics, there was 20% or 30% of the horse that was jumped without shoe as a show jumper. And the top 3 at the World Cup were horse without any shoes. So maybe it's something you can take into consideration, because you see progressively the show jumper learn from the trotter that removing a shoe give a better proprioception, better speed, better feeling of the ground, etc. So it's just probably the beginning of that. It was one of the winners of the Prix d'Amérique. This is one of the best friends, Jean-Michel Bazir. It's a Swedish champion. Training. There's very few collaboration in France between thoroughbred trainer and trotter, almost zero. They are not the same, and I don't mix with the French thoroughbred trainer. I can discuss, I don't feel comfortable. I love the horse, but the trainer are difficult for me in terms of friendship. But in trotter, and this is trotter, and this is at the place of François Nicole, who won the Grand Steeplechase of Paris 3 weeks ago. He's one of my best friends. It is at his place. My daughter was just, he said, let's go this morning. And she was 12-year-old, and she raced. I was allowed to be the winner of the Grand Steeplechase, so he was so proud. So they are easy people, and they connect together a lot. So many trotter trainers have horses in the steeple jumping, and many steeplechase trainers, I would say jump race horses have horse in the trotting. So they mix, they speak. All the dinner, I'm the dinners of life. Oh, I just try this, use this inhalation, make blood sample now, do that. So they collaborate a lot. And I realize that collaborate a lot in terms of training. Alternate training, meaning 1.4 thousand meter with a countering, stop, do again 3-4 times for reinforcement of the throat muscle is something that is used a lot with a steeplechaser. And you know this discipline is a big demanding in terms of throat, of respiratory capacity, is the same of trotter. So they use a lot of strategy in common, and they discuss a lot. And I can, as I'm often part of this discussion, something with some alcohol, so you can speak more, and then it's very easy to understand better what they do. And I learn a lot from this guy, because they show you what works and what doesn't work. And it's not a big deal if they fail. They fail, but at the end they win the Grand Steeplechase. François Nicole is 65. He was the top gold trainer for 15 years, and he have never won the steeple, always fair. In the first year, he won the steeplechase. So it's interesting to see these people. So I learned a lot from them. Another thing is, I show you in Grosbois, it's not in Grosbois, it's a country, but it's the same. There's a road for a road for the drive, for the car, and one for the horse. So you can always follow the horse with the car. We all do that. So the horse is fast paced. So you see this horse is displaying the soft palate, but you can follow, see that the horse will display it when the rider pull a little bit and try to stop, because you see clearly. So you can see the nostril, you can see everything, see how the horse will react. So it's something we are used from the beginning. The lameness, I was always close to the horse, full speed with the car, video. You can be in the sulky also, even if you are not in the sulky. From behind you see everything. You don't see everything when you are riding a horse, but when you are behind you see a lot of things. So this aspect also learned me a lot in terms of gait, and in terms of assessment of the nostril. It's very difficult to see anything what happened here, and on the mouth and everything, on the bit. You see a lot when you are driving a car nearby a racehorse. So in terms of surgery, what I learned, bad epiglottic entrapment. this is what a topic I had a lot, and I know there's a lot in thoroughbred. I changed a lot of things. This, if you start the laser or everything in this kind of epiglottis, you have a bad day, you have a problem. And the trainer, they call me now, I have a horse, but 2 weeks after, they need the horse back to training. If you tell them it's 3 months, no, it's impossible. So it's a disease you have in trotter, maybe because the sun, they have a lot of sand when they race, or this, we call it mash fair, the black racetrack with these metal things is very irritating for the throat. So maybe they have, so I could try. And what I did, I vary my technique, and I could check the horse every 2 days. So that's good. So you learn a lot. And if you scope an epiglottis after 2 days, and it's like a nightmare, and the trainer see it, it's not a big deal. So, oh, wow, impressive. What happened? I think I made the wrong decision. Check it, fix it. So I learned a lot. What I learned is I don't use the laser. I use several forceps and just use scissors. So I just sharp, safe. I make it simple, but I've changed a lot my strategy by putting tension on the tissue, understanding better how it works, seeing exactly where I need to cut, and it's improved a lot my success rate. And you see some epiglottis, removing some part, knowing how it works, etc. So this one, so this kind of epiglottis entrapment so far 24-hour post-op, and we put them back to training around 2 weeks. And I must say, last year or 2 years ago, or 3 years ago, maybe it took me 6 weeks before getting this fixed epiglottis. So trotter learned me to not be ashamed to check complex disease like the epiglottic entrapment, and to change my strategy in thoroughbred. So this is one of the aspects of surgery. Post-operative, if you go to a stable in France, in trotter, 60% of the horse have permanently this kind of inhalation. There are many drugs that they use a lot. And you can see the impact of this budesonide, for example, for inflammation. I know thoroughbred, they put a tube and flush a little bit of nasal spray, oral spray. We make many studies about blue ethylene blue. There's nothing arriving in the larynx, zero. So inhalation, we do the same, and there's a lot of drugs, corticosteroids, that go directly to the target. So we learn also a lot in terms of pre-operative and post-operative management, all the inflammation. We only use that for corticosteroid IV when we can, but we have stopped any syrup, anything like this, because the syrup is supposed to go in the esophagus, and the epiglottis will flip up and prevent any contact of the syrup to the arytenoid. Or you push too much and you have the horse coughing, but then you irritate the larynx. It's not the goal. So I know there's many studies, but in the fact, I noticed that this kind of treatment that is very common on the trotter was useful for me to assess pre-operative and post-operative effect of the way to put some drugs as corticosteroid. Another thing, Tim spoke about nasopharyngeal instability. We have that immaturity in thoroughbred. Yes, definitely it happened. But at least in Chantilly, especially in steeplechasers, we have also not often, but sometimes in adult 4-5-year-old jumpers, some thoroughbred. I had a couple in Dubai also. And I'm working, with this Altano group, committee. I'm working a lot in Sweden, and Scandinavian country, Norway, Sweden, where we have some hospital there. And I go every month to Sweden. And in Sweden, we have this horse that's called cold-blood Scandinavian trotters. It's like a cub going fast, but they all rest a little bit with a slight flexion of the neck like this. And they have this pharyngeal collapse. That can be dorsal, that can be lateral, or can be the circumferential collapse. So it's a common disease like this. We have that in the sport horse, dressage sure, a lot. It's linked to the flexion, but also we have in some jumper. This good show jumper was sent to me for a tie back. So we don't have the noise, but the noise is very close to rotor noise. But when we scope in, you could see that it is a pharyngeal collapse. So we have this disease quite commonly due to the mixed population we have: sport horses, standardbreds, and cold-blood trotters in Scandinavia, especially Norway. There's many studies that show that the flexion of the neck has an impact on the collapse, dorsal collapse and lateromedial collapse. And there's theory of that. There's the main cause is immaturity due to the inflammation that disturb the nerve, the innervation of the pharyngeal wall, especially the stylopharyngeus muscle, that is a muscle that tends the dorsal aspect of the pharynx. And there's another theory, but it's proved to me that it was true, that is a failure to equilibrate the pressure between the nasopharynx and the guttural pouch. It was described 10 years ago. And also what we noticed, due to the treadmill exercise we use, the nostril obstruction, nasal obstruction, false alar fold, or real nasal obstruction are an impact of that. If you know that, because if you make a pre-purchase or a sport horse and you close the nostril in order to try to induce the abduction of the larynx, most of the time you have the pharynx that drop down. And if you just do that, scope it off, put the nostril closed, and you will see immediately you will have so it has an impact of that. And due to the treadmill and trotter, we could confirm that in some, so it gave us some idea, not certitude, but ideas. So treatment in trotter, they use a lot, many systems, especially this system, training aids and inhalation. And surgery, we use fenestration, and we always combine for the dorsal collapse with alar fold removal. And to prove that, we have made many cases where we just fix or glue, just put super glue. And a good idea to do that, you take your horse, you just come, put super glue here, fix the alar fold, two sides, just go again, and you contour. And there's many horses that you don't listen the noise anymore. You can suture it also. It's a little bit more aggressive. So in this horse, we are using a lot this fenestration of the guttural pouch. The only difference, we add some drugs to prevent healing. I have 2 or 3 trotter. I finish with that, and I need to do it every 6 months. So it's good. They know exactly win, 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 last, win, win, win. So they do that. The good aspect of the trotter, they rest 10 years. So it's a thoroughbred in France will rest 3 years, 4 years, 3-year-old, 4-year-old, it will stop. A trotter, you can follow him for 10 years. So especially with that, I have a trotter. I've made this surgery probably 6 or 7 times already, and I repeat that. So for that, I have treated to put mitomycin, another drug. You can inject to prevent scar tissue to happen. So it let this all longer in time. So it prevents recurrence in the middle of the resting season. And we remove the alar fold. This is mainly for the dorsal collapse, but we had, due to the multidiscipline, the experience of, again in this Scandinavian horse, lateral pharyngeal collapse. In this dressage horse also, quite sometimes, especially with this position of the neck, and in some thoroughbred, especially the thoroughbred that are pulling quite a lot and flexing like this. We observe that. I don't know if Tim had the same experience. And this is a trotter from Scandinavia we have, you see. It looks like this when you scope it. So it looks a little bit like aryepicutic fold medial deviation, but it's not really, because you see there's something that is pushing that. So unfortunately, I couldn't get too far what I would expect. I would love to flex the neck, check in the fluo, I have many plans, but I just need time and money for that. But it's interesting. But what I notice is all these horses, when you flex them and make an X-ray, just an X-ray or fluo, the larynx is embedded in between the jaw. It's very cranial, like in a typhoid. And then when you do that, you see that the thyroid joint, so this joint between the thyroid and the thyroid here, is exactly at the level of the archipodetic fold of the larynx. And it seemed to us that it's a picture of Homme Duchamp, just the larynx cannot expand. And this joint is pressing, you see this? It's like an archipodetic fold collapse, but this is not the wall. This is not soft tissue. This is not muscle. This is this joint that is pressing on that. And the minute you go up, you make an X-ray, the larynx go back. The problem is, and I had the same 3 weeks ago, a typhoid. I thought that a typhoid, you cannot over-tight, but you can. So when I do a typhoid, I flex 60 degrees and not more. And I had this experience that if you flex more and you tight fully, you might have your larynx in a very dorsal and very cranial position. And then this joint is very close. And I have 2 cases last year where I got a lateral pharyngeal collapse on this horse. I just cut the suture, leave a little bit the larynx go backward, and it was fixed. And the other thing is multidiscipline vets. We have a vet in Sweden that is doing a typhoid for everything. So he's doing probably 3,000 or 4,000 in his typhoid. He's doing typhoid for rower, typhoid for nothing, typhoid for asthma, typhoid for... He only do that. So he's a crazy guy, but at the end, but it's good because we have a lot of complication in Sweden. And so in all these horses with typhoid, especially the dressage horse, that are not supposed to get a typhoid because the larynx is always in a proper position, I got a lot of pharyngeal collapse, a lot. That the horse was bloody, noise, couldn't breathe again due to the typhoid. And then we start in all this complication or in the blood just to remove the ceratoioid, so this part here, to put the larynx back. So it's a reverse typhoid we did, and to put the larynx caudal despite of the flexion. Because sure, you can ask to put the head in more extended position, but it's not possible. You can ask a dressage rider to put more open, and you can ask Scandinavian racehorse to go like this because they just do not trot. And then in probably now 30 horse, we just make a ceratoioidectomy, and then at least 70% of the horse were fixed. So it's just an idea, but it's just to show you that observing other discipline, learner, and I don't know, but I had a thoroughbred that had the same problem a couple of months ago, and I did the surgery. So far, it looks good, but I didn't have the opportunity to scope him again, but it's some idea we can get. Another area that we focus a little bit more than before is alar fold and nasal collapse. So the reason why is it seems to me that we have more this problem in sport horse and trotter than thoroughbred, but maybe we don't know. Maybe we just don't detect it in some thoroughbred because it's difficult to assess. So in our trotter, it looks like a DDSP a bit in terms of noise. I'll show you. So it's a little bit, it's short, sorry. And sometimes this disease is associated with the DSP, with a very similar noise. So it's a tricky diagnosis and leads also to pharyngeal collapse. So when you put a horse on the treadmill, you have all the time to observe that. So it's a very nice way. And if you look closely the nostril, you can, especially on a trotter, because the neck is not moving, you can see that this is a bit different than a normal horse. And you can see the flaccidity of the lateral nasal muscle and the redundant muscle. Here it's a sport horse, you see. If you look on the So this horse has quite a degree of obstruction, and we have more and more cases like this where we just combine this ala-fold resection with our primary surgery, or we do the primary surgery first. The results are not optimal, and then we do it secondary, and we have increased our success rate. So I don't have certitude, nothing ready, but we look more and more on this nasal. If you know that the diameter of a nostril is inferior to the larynx, it could be a limiting factor for that. And the same rules, if you have still vibration, then the respiration increase, the negative pressure increase, then the other nostril collapse, and then the larynx can collapse because the resistance is also expanded to the larynx. So there's many, it should be an impact. Don't forget that the horse is a nasal breather, and with all this membrane ala-fold, and when you palpate ala-fold in a horse, they are different. Some horses have very big ala-folds, some horses less. So we used to fix them like this and train the horse and do the DRS at the same time, just after. So we did that a lot in our trotter. The good point of the trotter is you can ask two riders or so to be together and have a look on the nostril of the other one. And it's something we do currently, and at least in our trotter population, we think that it's a disease that is much more common than we thought before. And then we remove this ala-fold by ligature. Nowadays, you can do that in 5 minutes with the ligature. It takes less than 5 minutes. You can do it standing. You just block, do the ligature, and there's no complication except some smell. There's some healing that smell a little bit, that's all. So we have never seen a complication of that. So the question is, why not to do it in any pharyngeal or laryngeal problem? So you reduce the increase of negative pressure you might have. But to increase your knowledge, it's good to test before. And test before you can glue it. This gluing technique for test was shown to me by in Rudd and Riedel in the course. This American, they have this saddlebred in America with this big flexion, and they have a lot of laryngeal problem. So they always glue doing the show that they can do everything, and they realized in a show that the improvement of the noise was terribly better after gluing the nostril. So it gave me the idea that if this gluing technique could be helpful for a show we're doing the noise, we should have probably more horse that we know that have an impact, that this obstruction might have an impact in other disciplines. And then nasal paralysis, I have at least 10 cases last year. I didn't operate all of them, but it's a bit different. It's a facial nerve lesion. The facial nerve is innervating a lot of muscle at this part, and there's a branch which is innervating the lateral nasal muscle, this one here, just here between the incisive bone, the nasal bone and the incisor bone, just here. So here there's and in some discipline there's nose bones that are really tight. Last Friday there was a race in Vincennes, and the son of my good friend was tightening the nose bone, and the nose bone was really tight. And then the father said, what are you doing? And then he relaxed. He said, I remember we had a big complication. We didn't have the horse back after this. So the trotter, they are aware about this nose bone. And they always put a nose bone, being able to put 2 fingers between the nose bone. But in some discipline, they tight a lot. Look at this horse, like it's very tight. And in trotter, some trainers, they attach the tongue and they attach strongly. And in this trotter, we had some lesion of this nerve. So this is the muscle here between the incisor bone and the nasal bone. Examination, you can just have an idea of the noise. The noise is not perfect, but also the treadmill. So look at this horse. This horse was referred for a persistent noise and intolerance at exercise. for 1 or 2 years. He was a very good horse, and he got a tie forward in another clinic because the noise was quite similar, and it was not improved, so it came to our place. The tie forward was good, everything was okay, but when you look at that, you can see that it's not the alar fold, but the wall of the lateral aspect of the nose seems to be depressed on one side only. And this was a pathognomonic alar fold paresis, I would say, of aspiration are bilateral most of time, but nasal collapse are unilateral. And here you see this. This should have an impact because the diameter of the airway is half and the other side is okay. So just unilateral. I'll show you again so you can see better. Another, in my sport horse, I use a GoPro. So this horse has the same problem. So you put a GoPro and you launch or you ride it, and then you record the image of the nostril from the top, and you see this horse had the same problem. So it's a nice idea, I think. It's not my idea. Many of the good ideas are not mine. I don't tell you, but it's an idea of my former resident, Olivier Brandenberger, who is a very innovative guy. So he showed me that, now we use that. And the technique we use is to replace the paralyzed muscle by a titanium mesh. We insert the mesh between the two layers of the mucosa and the epithelium, and then we fix with suture. And this is the horse before and after 6 weeks. You will have a closer view now. And the horse fix and improve a lot after that. So there's details. It's not big science, It's just observation for multidiscipline and some tips and some idea for research. So my aspect of research is very simple. I have a problem. I have sit down and try to find an idea, and then I demonstrate this idea. So it's always not very scientific, but it's always nice and it's always practical things. So for this, we have an idea of, collapsing one nostril by suture or something else, and then see the pharynx, the deformation in the trotter. Do the same for flexion, making a fluo on the treadmill. Then there's many ideas. I just need time, but many things are interesting just by observing. And as a take-home message is the mix of the discipline is extremely useful. Because if you look on the trainer, for example, in Chantilly, we have a huge amount of fracture in Chantilly. We have 1 or 2 a day, like probably here, a lot of carpal bone, a lot of condylar fracture, a lot of this. And then the rehab. The rehab is always the same. 2 weeks rest, hand walking, treadmill, go back to so they go to the stud farm, they start to work. For example, there's no walking treadmill. No one. You are the best, one of the best horses on the planet with million horses. There's no treadmill. So they rehabilitate by hand walking. And then they go to the stud farm, they start to trot. So how you can rehabilitate properly a third carpal bone or a condylar fracture without any proper treadmill activity? It's not possible. And in trotter, they have treadmill. In any trainer has at least one walking treadmill. And they spend the whole day being like this. And if you compare the success rate of the third carpal bone fracture in the trotter and the thoroughbred, even if it's not the same discipline, is nothing to compare. But I think the rehab is not the same. And probably steeplechasers are different. Economy is different now, also because they have less and less, at least in France, people to work, less staff. So there's many things also to see. And the economy in the thoroughbred industry is not the same in standardbred. So just to tell you that I like that you can be inspired by many things in trotter and show jumper, and you can learn a lot of things for your own discipline. Thank you.
Fabrice, thank you very much. Quick question on the nasal dilatations and collapses. There is the nasal flare that you can glue on that's available.
Yeah.
And it's used in many disciplines, and quite often it's placed in the wrong place, but that's a different story. How effective would that be in these cases?
I don't know, to be honest. It just flipped the problem is animal welfare prevent that forbid that in front in training and racing. So it's totally not allowed. So I even don't test it, but it's a good. It was used a lot. You're right, but so far I don't think I can find it, because in France it's terrible. The rules for animal welfare is really terrible, and they provide everything. Everything is forbidden. You cannot use any type of things. It's paradoxal when you see the trotter with this, but now the trotter, you see all this bit like this. Now, if you go to Vincennes, they need to have the head just like this. No artifice, very few one. In training, a little bit more, but not for racing.